Hello everyone, myself Dr. Lovkesh Mittal, your snoring and sleep specialist. So today we will talk about how to stop snoring, what are the treatments for snoring, and whether snoring is dangerous for us or if it is normal. So I often try to explain to all my patients in this language that whenever we breathe, there is a passage from the nose to the chest, which is called the airway passage. So if there is no obstruction in it, no problem there, then we can easily breathe in and breathe out and we won't snore. So if any of these 7 things occur, such as a deviated nasal septum, swelling of the nasal tissues, formation of adenoid mass, loosening of the soft palate at the back of the throat, having tonsils in the throat, thickening of the tongue, or the epiglottis falling back. So if a person has any of these 7 issues, whether it's 1, 2, or 3 of them, these can cause snoring, and the severity can be determined by the sound of the snoring. The louder a person snores, it is possible that they might have problems with all 7 of these factors. So by listening to this, we can understand how these 7 problems can hardly be considered normal. So snoring is not normal, and we should understand this as soon as possible. Now, what are the danger signs? The very first danger sign is snoring very loudly. If you feel that the intensity is very loud and it's even bothering your ears, then generally your spouse, brothers or sisters will also have a problem with it. So listeners, if any of your brothers, sisters or spouse, your wife or husband are doing this, then tell them please get an ENT checkup done once. Getting a checkup won't do any harm. The doctor won't suddenly tell you something that will completely change your life. But if there is a problem that is causing our blood pressure to rise, because of which we can't stop taking our medicines or can't stop taking diabetes medication, which is very common in patients who snore, because when a person snores, they also start having trouble with their breathing stopping. It's as if 4 things in their body have come to a halt. They suddenly swell up and the patient starts to choke. This is also called apnea, which means the stopping of breath. So in such cases, the patient becomes highly prone to developing diabetes, hypertension, stroke, and cardiac arrest. So in such cases, do not ignore it at all. And if your weight is increasing, especially if it's rising rapidly and you have to get up at night from bed, then see an ENT specialist as soon as possible. There are both medical and surgical methods to stop snoring, but the best plan is that you should first go to the doctor. After that, you need to have an on-table discussion. Discuss openly with your doctor all your old medical records, any diabetes medications you are taking, how quickly they are being increased, any hypertension medications you are on, or if your weight is increasing significantly. Talk about all these things in detail. And I can tell you with complete confidence that we have brought many patients down from 125 kilos to 80 kilos only by treating snoring. Snoring is the mother of all diseases. It does not allow your normal system, your internal system, to heal properly. Nasal discharge drips into the throat becomes dry, it's difficult to drink water at night, the stomach gets bloated, and even eating a little causes gas. From top to bottom, our entire system gets affected because of snoring. In fact, many patients experience mucus draining into their ears feel heavy, and their head feels heavy too. So if you are suffering from any of these snoring related issues, meet us as soon as possible. We will explain everything to you in detail, and there is absolutely no need to be afraid. We have all the facilities for sleep apnea and snoring. We have a complete sleep lab here, and we are the most trustworthy doctors for sleep apnea. We have been working on this for the last 10 years. So if you have any issues, please come and meet us now. We will talk to you openly about this. Thank you.